Hi, this is Don Pelto. Welcome to Podiatry Practice Mastery. I have my special guest, Lynn Homisak, and she is well known within the podiatry sphere. And we are going to talk about dealing with staff. Welcome, Lynn. Thanks for joining.
Thank you, Don. Always a pleasure to speak with you.
So I'm going to pick your brain, and I gave you these questions before, and because I know you wanted to do your research, but we're going to talk about staff. And
Yeah.
I've had a lot of members of my Practice Mastery Academy. They asked, Don, how should we deal with staff turnover in our practices? And I thought, well, better to ask you that has been dealing with this for a long time. So how should we deal, and has it changed over the years that you've been dealing with practices?
It hasn't changed, but the first thing I would say when dealing with it is to take it seriously. I mean, losing staff is not only disruptive to efficiency, it's also costly. It's when you think about the fact that it would take anywhere from 16 to 20% of an employee's salary just to, it's a big chunk of change to just throw out the window. You're talking about advertising, screening, interviewing, paperwork, training, correcting mistakes. It all works into it. And I just realized, I was looking at one of my past articles. It takes 12 to 18 months to actually train a new hire to be at the same level that your productive staff person that left was holding. So that's a big disruption for the practice. So costly and disruptive. I just want to say this one thing. A DPM friend of mine back in Washington, he said to me, Lynn, my goal is to find a staff who will stay with me until the day I retire. And I plan to do everything I need to make that happen. And I think if everybody had that mindset, we wouldn't even have this conversation today.
Yeah, I think when I started about 15 years ago, our staff, we had a lot of long-term staff. So we had staff that had been there 10, 15 years and similar. And then, but as of late, it seems like the turnover, like you said, it takes about a year to year and a half to get them trained. And then they might go on. We have a tendency to get a lot of NP, practitioner, and PA students that are going into advanced. So I'm glad they're going into advanced careers, and they need practice in a medical complex, and so that's why they're with us. And we leave them, and we know they're going to be great professionals, but it makes it hard on us for training. So
absolutely.
So how do we reduce staff turnover? I know you mentioned to a few things.
Well, probably not. Don't ignore it. First of all, take it for as serious as it is. Focus on what you can do to keep your staff there. One of the things I would do is to take an exit survey. I don't know if many doctors do that. And the reason they don't do it is because they don't like to hear what this person has to say. You know, somebody walking out the door is not going to hold back at what they want to say. So take them at their word. If you really are interested in making a change to keep staff there a little bit longer, listen to what they have to say. And it's, by the way, it's not mandatory that they have to sit for an exit review. So it would be good if you could talk them into taking it for the purpose of improving your practice.
And so what you mentioned about like taking it serious, let's say we get a couple of people that are giving their resignation. How do we diagnose like the cause of that? Is it, what are some signs and symptoms maybe that we would look at?
Well, again, Don, I'm going to go right back to that exit interview, because if no one tells you why they're leaving and no one tells you what the problem is with the practice, how would you know? I mean, you can ask the other staff people, they may be a little bit reluctant to say anything while they still have their job intact. So I would really focus on, if you're really serious and you don't know why could they possibly leave my practice, I have such a wonderful practice, ask them and they'll tell you. And
I think sometimes I've had this, sometimes it's a toxic employee, sometimes can be the cause of it. Sometimes is it usually due to like pay amounts, or like is it usually due to others? What is it?
It's due to a lot of things. It's due to, by the way, that toxic staff person, if you have one in your practice currently, do what you have to do to get rid of her. And I don't want to say it that way, but she's going to make it negative for all the other staff people that are there. And they'll look at you and wonder, why is he or she keeping this person in the practice when she's doing so much damage? So get rid of them. And then the other, what was it you just asked me? What?
Um, we're,
Okay, I'm the one getting old, Dawn, not you.
I know, but I'm thinking about the next question. So I like, is it a toxic staff, or like, are there other reasons why, what are the most common reasons they're leaving?
That was it. That was it. Right. One of it is poor management. Okay. And they say that studies have shown over and over again that people don't leave because of the job that they're doing. They're leaving because they have poor managers, poor leaders, poor money, poor pay, absolutely no benefits. And the job just is a nowhere job for them. They're not going anywhere. They're not growing within the job. They don't look at it as a career. They're looking at it as a job. And that makes a big difference when keeping someone there. I mean, I didn't know anything about podiatry, Don. I didn't even know what podiatry was. I didn't know there were doctors that treated just feet. But I was a patient. And when I started, they took me from scratch and built me up, and I stayed there 30 years. So
Wow.
you don't need to have someone that's always, that has the background for medical.
Yeah, they don't have to come in as a stellar employee. I think they can be created.
They absolutely can be created. I'm the perfect example of that. I'm still here 50 years later,
Yeah.
and I love it. And it has
Yeah.
become a
Well,
career.
you started when you were 2,
I
so.
was 2. That's right. Get that across to everyone.
So, and this kind of goes over to the whole topic, like how do you attract good qualified stellar assistants, or are they created qualified and stellar assistants? Like, do you look for good people, or what do you look for when you're looking for people?
You've heard this, many doctors say this before, you look for personality. So many doctors have told me, Lynn, you don't understand. There's slim pickings out there. I can't find loyal quality staff. Granted, they're not banging on your door. I don't expect them to, but believe me, there are plenty of people out there looking for work, particularly, post-pandemic. They
Yeah.
want to get involved in something. And so I would just say put a good hiring plan together. And once you get them, don't forget about them. Nurture these people when they're in your place. And to find somebody, you chat it up. Just like when I'll ask a doctor sometimes, how do you get your patients? Do you have a great marketing plan or what? And they say, I really just use word of mouth. And that's the way we get our new staff people as well. We tap into the people, our staff that are already there. It's like, you're such a great staff person. Are there more of you out there? Can you recommend someone to come to the job?
Mhm.
So, I like to even offer some kind of an employee incentive program to try to recommend someone else to come to the office. And
So
maybe you'll
you
get the
like a
same.
little bonus or something like that if they recommend another
Right,
staff person that takes a
right.
job, kind of like the apartments. If you have an apartment and you recommend someone, you get a $500 bonus or
There
something.
you go. Right. But that's
Hmm.
any kind of incentive, any kind of benefit will keep a staff person there. And there's a lot of benefits, including, like I said, being a better manager, appreciating them, recognizing them, all things that make going to work fun and enjoyable. I tell doctors all the time, you're not responsible for making the environment fun, just permitting it to be fun.
Mhm.
Allowing it to happen. Staff person, we all work 8 to 10 hours a day, sometimes more, right?
Yeah.
So if you're going to wake up in the morning and just have a distaste for going into work that day, nobody's going to be happy. And happy employees are what make long employees. So
Now, you mentioned a little bit about the training. So how long should the training be? Do you recommend like how can people, do they make their own? Can they be found somewhere? Like all the stuff you have to train someone? I know we have our own little like training manual. They have to learn, they have to see it, do it, and then teach
right.
it type of thing.
Right. Well, first of all, have an orientation program to make these people feel comfortable in their job, in their new environment. But other than that, as far as the training goes, there's a ton of training tactics that you can use, strategies that you can use. My favorite one is having them follow the doctor around. I mean, first thing, and this happens all the time, I see it. They have a new person come in and right away they put them with the other staff person that was replaced or, is going to be replaced. Teach them everything you know. I would rather them know a little bit about how the practice runs first, what the doctors do, and how they answer questions and what instruments they use and what kind of supplies they use and how they, like I said, answer questions that the patients ask them. They're learning by that. And so if you follow the doctor for, say, I would say anywhere between 1 to 2 weeks, not do anything else, but just follow the doctor, then start integrating into what you need them to do and work with the other staff people to do it. And you should have a manual that helps them as well.
But I think that's great because when you shadow the doctor, you get to see the magic that happens behind the door.
Absolutely.
Because all they see is the mess that we make. They don't see the magic that happens when we're talking to them.
Learning too, Don. They learn terminology and bones of the feet and, like I said, instrumentation and all those things and why situations occur and how to prevent them from occurring. And they listen to what they're telling the patients and they're learning at the same time.
Yeah, and I see. I always tell them it's kind of like drinking out of a fire hydrant because you don't realize, but like you have to position for X-rays. You have to be able to drop injections. They do so many things. It just goes on and on and on. Like people don't realize how much stuff they do. It's not just like putting them in rooms.
Well, it's really nice to hear you say that because I think that's true. I think more doctors need to realize the value that the staff brings to the productivity and the efficiency of the office.
Yeah. And so speaking about productivity and valuable employees, currently, like you have this range, like in Massachusetts, the range for medical assistants is this, and we tend to, right now we're on the higher end. So how do we determine how much to pay them and bonuses or tips or things like that?
Yeah. Don, about 2007, I think I did a survey within podiatry. I don't know if you remember, it was in podiatry management. It was a long time ago. And at that time, the average to pay a staff assistant, because no one had ever done staff salaries before in our profession, it came out to be $12 an hour. That's like what McDonald's makes right now, McDonald's employees. But I did look, and a certified medical assistant will make anywhere from $21 an hour to top earners are $25 an hour. So 40 to 42,000 a year. We can't put a average salary on our assistants because they don't have any job descriptions standardized. They don't have qualifications, skill sets that are uniform across the country. So what happens is from office to office, things are going to be different. I would say structure a salary compensation model that basically starts with the performance of the practice. What can the practice afford to pay this staff person? And that might be different from the guy down the street, So is it flourishing? Is it barely surviving? Can it afford to pay a lot and get a lot, or pay a little and get little in return? So that's number one. Number two, you want to consider the economic indicators that are out there, our national indicators, and what the healthcare market bears, which is going back to that $21 to $25 for certified assistants. Okay. And then, the job analysis, you got to watch what your staff person's doing. How are they performing? What I like to do when I hire, because I do a lot of hiring for doctors' offices, is when I hire them, I say the wage for this particular job is X amount of dollars. Okay. If after 3 months or 6 months, depending on how the doctor wants to handle it, you are doing a fabulous job and you've caught on and your personality is great and the staff likes you and I like you and the patients like you, we will up your salary significantly. But I can't do it from the start because I don't know what you're capable of achieving. And so that gets them in the door. And if they like what they're doing after 3 months, raise their salary. They're worth, if they're worth paying a little bit more, do it. We'll lose them as well.
Yeah, and that goes on to our next question. How do you keep them? I know pay is part. Do you have like a plan, like within a year they should be a certified podiatric medical assistant and things like that you recommend?
You know, if they look like they want to make a career out of this, then yes, the certification is fabulous. But not everybody needs to be certified in order to
Mhm.
do what, what you train them to do. So yeah, if they look like they're valued as an assistant in the practice, they're going to want to stay. Just talk to them, tell them that we need you to stay here. We would love you to stay here because it's it's a great place to work, and we hope you feel so too. I would say that one thing I would want to make sure that the existing staff, once you have somebody leaves, it can be very disturbing to the staff that are there. They have to take on extra jobs and they make it look like, oh, the practice is falling apart. Just try to rebuild their confidence and tell them that this is still a successful practice. We're a successful team, and we're going to hire somebody else that's just like us to get through. I would say don't wait until the person's left before you try to figure out what you can do to keep your staff there.
Yeah. Is there a certain ratio in practices per provider, like front and back office staff? Is there a ratio that you know of or anything, or it just depends on the practice?
It used to be, and I don't know I haven't been in a practice for about a year. I don't know if that 1 year since post-pandemic has changed. I do most of my work from home now, but it was 2.5 full-time
Mhm.
per doctor. If you're giving them more duties, more patient care duties, hands-on patient care duties, you might want to have more than that. And that's plus an insurance person as well. So, I mean, it all depends on how the doctor operates and how, what they want accomplished during the day to
Yeah.
hire more. What I would suggest,
Mhm.
I don't want to leave this. There's a ratio of about 20 to 22% that you're looking for that runs a payroll ratio that runs a pretty effective office. And that is by taking your collected revenues, by dividing your collected revenues by your total staff payroll. And if that percentage comes out to between 20 to 22%, you're pretty much running
Hmm.
an average a good office with
Okay.
that percentage. And I've seen it work with less and with more, but that's, like I said, a general average.
That's a good number. So 22% or some, and then you're probably overhead probably is another 22 to 25% or
Right.
30%. And then you got yeah. Okay. That's a good number.
Yeah.
I know one thing we always say is we get a lot of compliments on staff, and we always say, and I tell the patients this, I say, we only hire for nice. I think everything else can be trained, but you
Nice
can't.
and kind.
Yeah, kindness and niceness is
It seems to be a lost thing right now these days, but they're out there. I know there's people out there.
and we have to treat them the same way, as the doctors. We
Has
have
to
to
be
be
mutual.
nice. And one thing I want to just say, one of my own pet peeves, that's why I put this as one of the questions, is how do we keep them busy during slow times? I have some older, it's just that when I see it in the older ones, they have this work ethic where they're always busy.
Mhm.
And they usually end up being the managers, right? So we have a lead, I guess we would call them, in the back, and she's always busy doing stuff. The younger ones, I just don't know what they don't know what to do, or don't have that same work ethic. Like sometimes there are not so busy times. Do you have any ideas of what we can do to keep them busy? So at least as a doctor, I used to get really like I'm sitting in my office and not busy, and I wish they were busy. And you know what I'm
Sure.
saying? Any
Yeah,
any
it's like
any
when I
thought?
see them reading a People magazine, I start to worry, like, what?
And nowadays chatting on their phone or something like that,
Oh, that's even the cell phones today, I tell you. But I mean, there's always things to do in the office, Don, like there's boxes being delivered, open the boxes, put them on the shelves, straighten closets. I like to teach them to take pictures of what they do, their
Mhm.
work, because different procedures change all the time. And you want to keep your procedure manual pretty current for new people coming in. And it's always easier when they can see pictures of how to do something. So walk around with that phone if you're going to use it, and use it usefully, take some pictures and put them in there. One of the things that they can do without even hesitating is go and help another coworker do something.
Mhm.
There's other people there that are doing some tasks. Maybe you can walk up and say, can I help you do something?
That's
Um,
good.
call patients that you haven't spoken to, that you might need to follow up with something, straighten out the reception room, go in the bathroom, straighten out the bathroom. No one should be sitting there, no one,
Correct. Yeah.
ever.
Yeah.
And if they are, I mean, have a couple, you could even work while you're having your coffee, there's no reason for you to sit there with a blank face, just not.
Yeah. Yeah. Well, good. And I know you said you maybe had some resources for those listening. I'll put a link underneath this podcast with your information. But is there anything specific that you wanted to offer or tell people, or any other last minute ideas?
I write for Podiatry Management Magazine, and I have a column called Ask the Consultant. It is not just for doctors, it is for staff people as well. And I don't know if they're seeing the magazine even. Sometimes it comes delivered and it goes right on the doctor's desk. If they don't get it handed to them, I would tell staff to go and read those articles, because there's a lot of valuable information there that would help both. My whole goal in podiatry from day one has been to build the relationship between the doctor and the staff. There's such a gap there in so many offices. And the more we can talk about what value staff bring to the office and how to act as a better manager for your doctor so the staff want to stay there, that's what I love doing. I do it in my writing, I do it in my lecturing, and I think if there were more of that bridging, we would have, it would be better for everybody, for the office's
Great.
success.
Well, thank you for your thoughtful answers to the questions, Lynn, and
You're welcome.
maybe we'll do another one in the future.
I would love that. Thanks, Don.